everybody. My name's Jessica Rees-Williams. I'm one of the psychological therapists here with ABL Health. And this morning, we're going to be looking at chronic disease and mental health disorders, the relationship. So thank you very much for coming this morning. This morning, we'll be having an overview of how our body and our mind is interconnected. If we could just pop back a slide, that would be good. Perfect. Thank you. So during this webinar, we're going to explore the connection between our physical and psychological health, have a look at how one impacts on the other, and what we can do to stay as healthy as we can. I think that's quite important, that we look at ourselves as an individual and what we can do to be as healthy as we can individually. Thank you. I'm going to pop my camera off now, just so we can focus on the webinar itself this morning. Okay, so I won't go through all of these individually. There's a few too many, but generally we'll just be looking at a summary of chronic diseases, mental health conditions, taking a look at some statistics. Don't know if you're statistics people, but I love them. Chronic disease statistics, mental health statistics, and how they overlap between each other. Then we're looking at an area that some of you might have discovered before or maybe not, psychoneuroimmunology, and the stress cycle that's involved in that. We'll be having a look at some of the symptoms of physical and mental health stress and how that involves the central nervous system, looking at the influences that are involved within all of these processes, and then breaking those down individually to see how they impact on us. And maybe the most important thing, what we can do ourselves. Okay, thank you. If we could move on. Thank you. So chronic disease. So what makes a disease chronic? So if we have a look at the summary. So the term chronic disease or chronic conditions is an umbrella term for a huge range of conditions that affect the body in many different ways. So whilst it's generally accepted that the term chronic disease applies to conditions which include all or some of the following factors, there are others involved. I've broken down some of these. So it's a disease or a condition which is generally lasted 3 months prior to a diagnosis and will be ongoing throughout a person's lifetime to some degree. So that's quite important. It's a disease that may deteriorate chronically, gradually, or remain stable. It may go into remission for periods of time. So a person may appear well at periods of time throughout their life. It's a disease that's unpreventable in nature. It may be controlled or lessened in severity by medication, but there's nothing that a person can do prior to stop the onset of these conditions. It's a disease or condition that generally can't be cured completely. Okay, so the NHS defines chronic conditions as chronic conditions are those which, in most cases, cannot be cured, only controlled, and are often lifelong and limiting in terms of quality of life. So chronic diseases or conditions can be visible, so seen to others, conditions like psoriasis, or they can be invisible, so not seen externally. Conditions like this can be complex regional pain disorder. They're just impactful on the sufferer's life, and one is not more severe than the other. They're very different. Thank you. If we could move on to the next slide. So if we have a look at some chronic conditions, and I'm sure we're all aware of some of these are some of the more well-known chronic conditions, and this list is not exclusive by any means. As it says here, there are far too many to name individually, and there are some more widely recognised types of chronic conditions. These generally fall into groups which are classed as chronic conditions. These include conditions like diabetes, COPD, which is chronic obstructive pulmonary disorder. Sorry, I had to test my own brain there. Complex regional pain syndrome, heart disease, musculoskeletal disorders, chronic kidney disease, autoimmune disease. I'm going to say ME because I just can't pronounce that one at all. I'm sorry about that. Got cancers and cystic fibrosis, but there are many, many more, too many to name. That's a few of them. Okay, thank you. If we could move on to the next slide. Thank you. So let's look at mental health conditions and a summary of them. I love this quote up here. So there is no health without mental health, which is very true. So the term mental health condition or mental health disorder or mental health illness are all very interchangeable terms which are used to describe a vast range of mental health conditions and disorders that can affect an individual in a huge number of different ways. So it is accepted that mental health conditions or disorders are very personal conditions. So they will never present in the same way twice, with their onset, their course, their duration, all being dictated by the individual factors surrounding a person's life. So whilst the symptoms of these conditions vary greatly, it is generally accepted that mental health conditions do share some characteristics, albeit at different levels of severity. So these are some of them, not all of them: how a person feels, how a person acts, how a person behaves, and how a person is able to cope within their lives. The World Health Organization defines mental health as: mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. The definition of mental ill health or mental health problems covers a very wide spectrum, from the worries and grief we all experience as part of everyday life, to the most bleak suicidal depression or complete loss of touch with everyday reality. Everybody responds differently to the stresses and strains of modern life, and it is common to describe ourselves as depressed, stressed, or anxious at times. For some, these feelings can become serious enough to make it difficult to carry out everyday life. Thank you. If we could move on to the next slide. Okay, so let's have a look at some mental health disorders. This image highlights a lot of them, but once again, far too many to name individually, but there are some more commonly recognized mental health disorders which fall into their own subsets. And some of these include anxiety disorders, mood disorders, psychotic disorders, eating disorders, personality disorders, obsessive compulsive disorders, and post-traumatic stress disorder. Thank you. If we could move on to the next slide. Okay, so we're going to start looking at some statistics, which may or may not surprise you. We'll see. So we'll start with chronic diseases. So according to a Department of Health report, 60% of adults in England currently self-report to live with a chronic health condition. So out of a population of approximately 59 people in this country, 1.3 million are affected by diabetes mellitus, with 8.5 million people being affected by arthritis. Of those affected, 74% report having 1 to 2 chronic health conditions, with a further 26% of these suffering with 3 or more health conditions. So that's a lot of health conditions. Over 8.8 million of the population within England have a chronic health condition which they've defined, or which is defined, to severely limit their ability to cope daily. So if we look at if we look at this chart here, which was the average quality of life score for adults with a self-reporting condition, this was carried out by PHE analysis of general practitioners patient survey. This looked at the quality of life score. So people reported how they felt about their lives. Individuals with no long-term health conditions generally reported a quality of life score just over 0.9. You can see as the chronic conditions are listed, the quality of life score declines, with the lowest quality of life score being reported by people with mental health conditions. And if we move on, thank you. Okay, so let's have a look at some mental health statistics. So we can see there quite clearly by that image that 1 in 4 people is affected by mental health. And that's right, 1 in 4 people will experience a mental health problem of some kind each year within the UK, with 1 of 6 people reporting to experience a more common mental health symptom, such as depression or anxiety, each week within the UK. Mental health disease and disorder are one of the leading causes of disease worldwide, with major depression being the second most common cause of disability worldwide. Within the UK, women, young adults, and those with pre-existing mental health conditions are those most likely to be affected. Thank you. If we could move on. Okay, so we've looked at chronic disease statistics and we've looked at mental health disease statistics. And now let's have a look at the overlap. So the overlap between long-term conditions and mental health problems, if we look at this, we've got 30% of the population in England, or approximately 15.4 million people with a long-term health condition. We've got 20% of the population in England, or approximately 10.2 million people with a mental health condition. Let's look at the overlap in between. We've got 30% of people with a long-term condition having a mental health problem as well, or 46% of people with a mental health problem having a long-term health condition. So that works out at 4.6 million people having that overlap condition. Public Health England also looked at a study which compared the general population to those with a severe mental health illness and how much more likely they are to have a physical health condition, to develop a physical health condition. So if we look at the likelihood in this, these individuals are 1.8 times more likely to suffer with obesity, 1.2 times more likely to become asthmatic, 1.9 times more likely to suffer with diabetes, 2.1 times more likely to develop COPD, chronic obstructive pulmonary disease, 1.2 times more likely to develop coronary heart disease, 1.6 times more likely to suffer with a stroke, and 1.5 times more likely to suffer with heart failure. So they're quite striking statistics. Thank you. If we could move on. Okay, so moving into an area that some of you might have heard of, or some of you have potentially may not, psychoneuroimmunology. Not the easiest word to say, the connection. Okay, I'm not going to say this word over and over because it's a tongue teaser. So it's a study of the connections between the mind and the neural, immune, and endocrine hormonal systems. It was initially made by Robert Alder, who's a psychologist. So the basic concept of this process is that our mind and body are inseparable, and the stress that affects the body has an impact on disease progression and vice versa. It's now been proven that the brain influences all sorts of physiological processes which were once thought not to be centrally regulated. Psychological factors impact many diseases, which can include autoimmune diseases, heart disease, diabetes. But it is largely believed that this link extends to all diseases in varying degrees. Emotions and thoughts have been proven to impact the brain, hormones, and central nervous system, which in turn impact the immune system's ability to do its job properly. When the immune system or the endocrine system dysfunctions, this can create changes within the central nervous system, which results in altered emotional and behavioral responses, which may result in mental health conditions, which can include depression. Depression is also known to suppress the immune system, making it easier for individuals to get sick, slowing down rates of healing, and making people more susceptible to illness generally. So if we break this word down, psycho means thoughts and emotions, neuro means the physical brain is involved, endo brings in the endocrine system, and immunology explains how our immune system protects us from illness. So it's this cycle. Thank you. If we could move on, please. Okay. So what we have here is we have the psychoneuroimmunology stress cycle. So we can see that this is triangular, but also a cycle. We have the physical psychological stress, which is linked through the environment into the immune, endocrine, metabolic changes, which is linked through the body into the neurochemical changes and the psychic consequences, which is linked back. It's the environment, the body, and the brain. All of this connects into how our mind perceives the behavior, the awareness, and the consequence. So these changes alter the mind and the behavior, awareness, and the consciousness. Next slide, please. Okay, so we're going to have a look here at stress and the body. So stress can be useful to us. It can help to protect us if we're in danger by triggering our fight, flight, or fight response. So this happens when our brain, the hypothalamus, triggers our adrenal glands to release stress hormones, adrenaline and cortisol. But once the threat is gone, this response should automatically stop, should automatically calm. If the stressor doesn't disappear or the CNS, central nervous system, doesn't stop this stress response, a range of physical symptoms will occur. Breathing and heart rate will increase. This is due to your body trying to circulate oxygen-rich blood. Stress causes the liver to produce extra blood sugar or glucose in order to provide an energy boost, and this is to combat the perceived threat. So whilst this is helpful and okay for short periods of time, trying to keep this up with any increased need put great pressure on the system, and this actually increases the risk of developing type 2 diabetes. Increases in the level of hormones have a negative impact on the gastrointestinal process. This impacts on the body's ability to process food, with symptoms such as heartburn, acid reflux, diarrhea, and even vomiting occurring as a result. And over prolonged periods of time, the stress hormone will weaken the immune system. It will make the body more susceptible to viruses, illness, deficiency, and generally becoming run down. And if we have a look at the diagram here, we can see that it affects many other areas of the body, top to bottom. So there's involvement with the brain, concentration, mood, mind fog, the skin, hair loss, delayed tissue repair, cardiovascular system, the blood pressure, heart attack and stroke, the gut. So we've already gone through constipation and vomiting, but we've got bloating, pain and discomfort, and nutrient absorption, which is really important. Got the joints and the muscles, so inflammation, tension, headaches and pains. The immune system, we've discussed that already. lowering those immune defenses, and the reproductive system. So decreased hormone production, decreased libido, and increase in PMS symptoms. Thank you. Okay, so if we have a look at the central nervous system, or CNS, and something called sensitization. So prolonged stress, as we've discussed previously, either psychological or physical. So this can be prolonged pain or an acute ongoing stress event, causes our body a continual fight, flight, or fight state. And these prolonged states can cause our central nervous system to become overactive or sensitized. So when our CNS is sensitized, we perceive that we're under a continued threat and experience an amplified response to situations which may not actually be causing a cause for concern, or which the reaction is very much exaggerated or amplified in comparison with the actual threat. So this is called an overactive response. When we experience this overactive response, which can occur at any time, and this can be situations that we know of or are completely subconscious or unknown, it can be caused or linked to stressful events, illness, injury, or trauma, amongst other things. These overactive responses can result in patterns, in cycles or patterns of behavior which long outlast the event or situation, i.e. a hurt leg, which is minimal, but the pain extends for weeks longer than it should. So sensitization involves a relationship between fear, anxiety, and pain, a relationship that becomes a pattern and one that becomes a cycle and repeats on a largely subconscious basis. If we have a look at the diagram that we've got here, you can see how the pain sits in the middle of the physical and psychological cycle. So we've got the pain, which may trigger anger, anxiety, or fear, which may impact on mood, cause depression, increased perception of pain, which can switch over into activity avoidance, progressive deconditioning, pain with decreased activity, further activity avoidance, further deconditioning, back into pain, anger, anxiety, fear, and the cycle continues. Okay, thank you. Okay, so we've looked at why, we've looked at how. So now let's look at the influences. So now that we understand that they are connected, very connected, and how one impacts the other, and we can also see from the crossover statistics that this doesn't happen in every case. So it wasn't 100% of the individuals with a physical health condition that led to a mental health condition, or vice versa. Let's look at why is that. What factors influence this? So according to a study by the WHO, which is the World Health Organization, this was in 2015 PubMed, 60% of related factors to individual health and quality of life were directly linked to lifestyle choices, with diseases and disorders such as metabolic disorders, cardiovascular disease, hypertension, and skeletal disorders all being linked to negative lifestyle choices being made. So what positive lifestyle choices can be made to impact on a healthier life generally? We're going to look at nutrition, sleep cycles, physical activity, social relationships, therapy and group support, CBT, some self-help techniques, mindfulness, and a mindfulness self-help technique. Thank you. Okay, let's look at nutrition. So healthy eating patterns such as the Mediterranean diet, I'm a big believer in the Mediterranean diet, are associated with better mental health, an increased chance of healthy weight maintenance, heart and brain health, joint health, and cancer prevention, and has also been linked to increased levels of energy and a brighter disposition. Foods high in refined sugars and saturated fats create several physical symptoms within the body. So that includes headache, dental disease, bloating, but it generally depresses the mood, causing temporary highs followed by lows. Foods with a higher dietary glycemic index or high GI have been directly linked to low mood and depressive disorders. This is due to being quickly digested and then causing spikes in blood sugar. Foods which fall under this group include highly refined carbs. Along with the mental health risks, they also increase a person's risk of developing diabetes, along with other chronic health conditions. And a good quality diet is directly linked to increased levels of energy, which is linked to increased physical health, which is linked to increased mental health, and the positive cycle begins. So if we have a look at our little diagram here, we can see good quality diet links to mental health, links to physical health. We look at the psychosocial and social factors involved, and we look at the biological pathways involved, as well as the physical and mental factors involved. So this starts that process of change. Thank you. Okay, let's look at sleep cycles, which are broken down into 4 different stages. So we have our awake stage, our light sleep stage, our deep sleep stage, and our REM sleep. So the Sleep Foundation have reported that having sufficient sleep, especially REM sleep, facilitates the brain's processing of emotional information. With people who don't get enough sleep having a harder time controlling their emotions, making good decisions, and coping with different aspects of daily life. Sleep deficiency can also lead to mental health issues such as depression. Studies have found that sleep loss can increase your risk of becoming obese. This is because your body produces and regulates various hormones during sleep. These include ghrelin, which makes you feel hungry, and leptin, which makes you feel full. Lack of sleep can cause your ghrelin levels to increase and leptin levels to decrease, meaning you're more likely to feel excessively hungry and overeat. Not getting enough sleep can affect how your immune system responds to viruses and other infections. Long-term reduction in sleep can also lead to persistent low-level inflammation throughout the body, which underlies many chronic medical conditions. A good night's sleep can improve your ability to concentrate, be creative, and learn new skills. People who don't get enough rest often have a hard time paying attention and are more likely to commit errors at work or in school. Blood pressure is generally reduced during sleep. Decreased sleep can lead to higher daily average blood pressure, which in turn increases your risk of heart disease. Thank you. If we could move to the next slide, please. Okay, let's look at some physical activity. So physical activity sets off chemical reaction within the brain by the release of chemicals such as dopamine and endorphins. This chemical reaction triggers the feel-good feelings, so happiness and joy, and they help directly to overcome negative feelings like anxiety and stress. So physical activity strengthens us physically as well as psychologically. It builds up our cardiovascular and respiratory systems, assisting with conditions that involve the heart or the lungs. It also reduces the risk from conditions such as type 2 diabetes, helps to lower cholesterol and keeps us mobile. Increased oxygenation occurs during physical activity in which the heart rate is increased. This promotes flexibility, improved cognitive skills, and benefit impulse control. Increased self-confidence can occur as a direct result of physical activity, with various studies having proven the link between positive self-image, increased self-compassion, and regular physical activity. Memory and thinking have also been proven to increase with physical activity, sleep cycles and physical activity have been shown to be interconnected, with individuals taking part in regular activity shown to have improved, more restful sleep. And something that some of you may not have known before, but post-traumatic stress disorder has been shown to be positively impacted by regular physical activity. And this is due to encouraging the individual's brain function and desensitizing arousal clues whilst regulating the stress hormones. Okay, thank you. Okay, so let's have a look at the impact of social relationships. So it's been shown that having positive, healthy relationships decreases anxiety and depression, whilst increasing self-esteem and trust. Lack of social relationships or isolation can result in an increased level of cortisol, the stress hormone being made. Increased levels of cortisol affect the immune system's ability to function, leaving people more vulnerable to illness with slower rates of healing and recovery, increasing their risk of mental health conditions. And although this is not a fact that's widely documented, it's now known that social relationships and having meaningful ones assists both our mental and physical health. This is due to an absence of social relationships causing an increase in the levels of the stress hormone cortisol, again, that we produce, which affects our ability to rest properly. It's been proven that individuals struggling with high levels of loneliness or isolation will have high levels of cortisol compared to their peers not struggling with these symptoms, which impacts on our ability to rest properly. Having strong social relationships reduces the likelihood of dementia, obesity, inflammatory conditions, and increased blood pressure. Thank you. We can move on. Okay, so if we have a look at therapy and group support. So psychotherapy or counselling, these can be hugely assistive when working with individuals who are facing both physical and mental health conditions. It looks at implementing stress reduction techniques, which can help in exploring how we process our trauma, working through the feelings associated with this, assisting with the acceptance of the situation, and how to move forward from it or with it. Family therapy. This looks at things in a slightly different way from an individual's physical and mental health conditions within the context of their entire family. So this form of therapy is often recommended for children and their family or a parent who's ill. This form of therapy will look at the impact of the health condition on each member of the family, with each having a space to discuss their part in the situation. And group therapy. So this consists of a group of people who share a commonality. So a particular health condition, for example. This form of therapy works on the basis that others are affected by the same condition and can share and support each other to move forward. Thank you. And cognitive behavioural therapy. So CBT is based on the belief that what we think about a situation is more connected to how we react to the situation than to the actual situation itself. So CBT can be useful in understanding how we respond to our health conditions. It aims to empower an individual, viewing the person as a whole and handing control back to the person. CBT hopes to help people to identify their automatic thought processes, which may be influencing their responses, and learning the techniques to challenge and change these responses. So if we have a look at the flow here, we've got the situation, the automatic thoughts, which will lead to the reaction. And then that's broken down into the emotion, the behavior, and the physiological response. Okay, thank you. Okay, if we look at a very quick CBT-based exercise that can be useful when we're facing a moment and we just need to stop. And it's actually called the stop technique. And I'm going to talk you through it. If you want to make a note of this, you can. If we can send this out, I'm sure that will be fine. Okay, and the S is for stop. So we just pause for a moment. We say in our head, stop. As soon as we notice our body or our mind is reacting to a situation or stress. The T is for take. We take a breath. We notice our breathing as we breathe in and out. We slowly breathe in through our nose and out through our mouth. We observe what thoughts are going through your head. What are the feelings in your body and your mind? What thoughts are going on in your mind right now? What are you reacting to? What sensations can you notice in your body? The P, pull back. Put in some perspective. What's the bigger picture here? Is this a fact or a feeling? If I was someone else, would I feel this way? And the P, proceed. What's the best thing for me to do now? That's the stop technique. We take that moment. Thank you. Thank you. Okay. So we're going to look at mindfulness. So mindfulness is a state of being in which we focus on the present moment, placing importance on the breath to reduce stress on both the body and the mind. So when we are practicing mindfulness, we don't think or focus on the past or the future. We center our attention on the here and the now. So the three core focuses of mindfulness are the intention to cultivate awareness, our attention to what is happening in the present moment, and adopting an attitude that's curious, non-judgmental, and kind. Mindfulness is a form of meditation. It can be used by anybody without the need for any specific equipment, and it can prove helpful in relation to a huge array of conditions, including chronic pain syndrome, depression, or insomnia, amongst many, many others. The benefits of mindfulness are vast and can be experienced system-wide, but include decreased levels of pain, an increase in balance of mood, increased attention and concentration, and improved sleep and rest cycles. Thank you. Okay, and here we have a mindfulness technique. This is a breathing exercise, and I'm going to do this right now. If you're comfortable and if you want to, nobody is going to judge you, so you can join in. I'm just going to talk everybody through this, and we can take a couple of minutes for ourselves. Okay. Find a relaxed, comfortable position. You could be seated on a chair or on the floor, on a cushion, or even lying with your hands resting wherever they're comfortable. Invite your body to relax. Observe the sensations it experiences, the touch, the connection with the floor or the chair. Do your best to relax any areas of tightness or tension, and breathe in and out, and in and out. Tune into the rhythm of your breath. Feel the natural flow of breath in and out. You don't need to do anything with your breath. Notice where you feel the breath in your body. Is it in your abdomen, your chest, your throat, or your nostrils? See if you can feel the sensations of breath, one breath at a time. When one breath ends, the next begins. If you're not able to notice your breath in all the areas of your body, that's okay. We're more connected to some areas than others. You might notice that your mind may start to wander. If this happens, gently redirect your attention back to your breathing, in and out. And we'll stay here for 2 minutes. Notice your breath in silence. From time to time, you'll get lost in thought. Just keep gently returning to your breath. Stay here for 1 more minute with our breath, bringing our minds back if they get lost in thought. And now we'll once again start to notice our body, our whole body. And we'll start to open our eyes. We'll move our hands we'll let ourselves experience the new feelings from within our bodies and minds. If you can offer yourself appreciation for the time that you've given to yourself, please do. Thank you. Okay. And this is our last slide. So this is about self-care. So I just wanted to finish off with the definition of self-care. So this is the noun of self-care: the practice of taking action to preserve or improve one's own health. The practice of taking an active role in protecting one's own well-being and happiness, in particular during periods of stress. Expressing oneself is an essential form of self-care. So looking after and valuing ourselves is necessary for a healthy life. Caring for ourselves promotes health, the ability to cope, increases independence, increases our abilities to maintain relationships and care for others as well. Thank you.